Hi, I'm Dr. Hema, Developmental and Behavioral Pediatrician, working at Ankura Child Development Center, Ankura 9M Hospital, Gachibowli. Our CDC, we work with children having autism, ADHD, and developmental delays. Today, we'll talk about autism on the occasion of the Autism Awareness Month. This is important because the incidence of autism has been increasing over the decades. At the present situation, we have almost 1 in every 68 children affected with autism. We do not know the exact cause for this, though there are a lot of genes isolated, there are environmental factors implicated, and also a combination of this. So it becomes very important to understand and help children who are on the autism spectrum.
So, ma'am, can you briefly explain what autism spectrum disorder is and how it affects children differently?
So autism spectrum disorder is a condition where children have a problem communicating, in the sense that even to ask for something they need, they might not even be able to point, or they might take the help of the mother or parent, whoever is there, to show what they want instead of showing it directly. They might not share their interest, like if they've done something which they built, and normally share it with the mother that, mama, look at this, I've done this, that they cannot do. Also, they are in their own world, playing with toys in the way they want. They can't communicate with children, and because of which they cannot play. For children, we don't expect them to do a lot, like hosting conferences or something, but for children, the minimum thing we would expect them to is to play with other children. So these things do not happen because they don't understand. If a child comes to them with a ball to play, they either take the ball and start playing the way they want, or if the other child is trying to explain what they want to do, these people might not understand, because of which they cannot play in the way the other child wants, in which case they might not play with these children the next time. So it becomes difficult for them to make friends. So this is the problem that they have in terms of communication, because that does not let them play. Also, if they go to the school, it becomes difficult for them to sit in one place. They keep going around. So learning a skill or learning something in the school also becomes difficult for them because of the various issues that they have.
So, ma'am, what are the most effective treatments available today for helping children with autism?
The most effective interventions that are used are evidence-based. When I say evidence-based, I mean that all over the world they have done research and found that these interventions help the children. For instance, the behavior interventions. So the behavior interventions are target what is necessary for the child and help with the communication, help with the interaction. These are the things that are necessary for the child. So behavior interventions target that, and these has to be provided in a consistent manner for a specific time. That is, you cannot do it once in a week or so. The better thing would be to do consistently at least 20 hours in a week. Similarly, we have the occupational therapy, which helps in the child paying more attention, reducing their sensory concerns, helping with their day-to-day activities. The speech therapy will help in improving their communication by providing a language as a mode of communication. They might use other aspects, but a language is more easier, but it does not mean that if they do not have a speech, they cannot go forward. But learning a language and being age appropriate will always help the child and leads to a better outcome. So the behavior interventions, the occupational therapy and the speech therapy are the interventions which are evidence based.
So, ma'am, we heard a lot about ABA, Applied Behavior Analysis. So, can you tell us about what it is and why it's widely used?
So there is ABA, also called as applied behavior analysis, is one of the ways behavior interventions is provided. The idea is that, while there are different mechanisms, this is based on teaching learning to the child. So they give a positive reinforcement. Like for all of us, if we do something and somebody appreciates us, we like to do it more. Or if we are given a reward, we are happy to do that. Like it's a positive reinforcement. Also, looking at what is the antecedent and behavior and consequence, an ABC model, wherein every behavior comes out because of an antecedent. That is, something has happened and this behavior is coming out. Or the child wants something and that is why this behavior is coming out. So, altering these two and helping with positive reinforcement is a method used in ABA. There are they have to be trained in this ABA to administer. It's not like any person can administer. It should be a proper psychologist who can do this.
So, ma'am, how do these therapies like speech or occupational therapy fits into a child's treatment plan, and what are the specific skills do they target?
So for the speech therapy, when you look at a child, you try to understand where the child is. Like suppose a 3-year child comes to you and you assess the speech level. You look at the child to understand if his speech level is at 3 years or age appropriate, or it is behind. Say the child is like talking like a 2-year-old child or a 1.5 years old child. So what you try to understand is the base level at which the child is, and then start teaching him so that he comes to the age appropriate level, which will help him with his communication. So as we have talked, the behaviors come out because he cannot communicate what he wants. That if you tell him the speech, if he learns speech, he can name that, say that I want an apple, or I want food, or I don't want this. So this helps in that communication. As far as occupational therapy is concerned, these children have sensory issues. So the occupational therapy therapist will try to help them with the sensory regulation, help them with the challenges that they face in terms of paying attention or responding to a name call, or reducing their hyperactivity, being able to sit in one place to attend to or learn a skill. So that is how, and also participating, doing your daily activities like brushing, dressing and undressing, indicating the toilet needs. These are the things the child should know. So it helps, occupational helps, the therapy helps in the child in being independent to do his skills.
Are medications ever necessary for children with autism, and what kind of symptoms may they address?
Medications don't treat the core symptoms, that is the communication and interaction or the repetitive behaviors. Unless the repetitive behaviors we may target if necessary, but initially we look at the deficiencies that are there. In terms of, if the child is anemic, you treat the anemia, which might improve the attention. If the child is having vitamin deficiencies like vitamin D or B12, you substitute that. Any deficiencies that the child has, it is supplemented. The other thing is, these children have problems with sleep. They either sleep late, or they have a disturbed sleep, or are excessively sleepy throughout the day. So this is dealt in terms of providing sleep hygiene measures. That is, the parents are taught how to help the child to sleep better by having a routine and making them sleep at the same time. And even after this, if the child after ensuring that all sleep hygiene measures are in place, which includes like avoiding the afternoon nap, having the sleep time at the same time, providing a comfortable room to the child. And after all these measures, if the child is continuing to have sleep problems, then melatonin is a medicine that is used to help children with sleep. Similarly, these children might also have constipation, which could be because of the various dietary things that they are taking, or they're not taking enough amount of water. So we initially tell them to correct the diet, the water intake, toilet train, and then also help them with some laxatives which will improve the constipation. Also, these children have ADHD, sometimes associated ADHD, that is attention deficit hyperactivity disorder, which is quite common in these children, in which case we give medications for that, which will reduce the hyperactivity and help the child. Also, if the child has things like seizures, seizures or convulsions, some of them have, managing these seizures with medication is essential. So medical management does not treat the core features but will help in the overall health of the child and help them participate in the interventions and improve. That is why it is necessary to follow up with the developmental pediatrician or whoever is looking after the management every 3 to 6 months.
So, ma'am, how important is early intervention and what should parents do if they are suspect their children might have autism?
Parents can suspect autism in children if they notice that their child does not give them an eye contact properly, or if they have to call the name more often before they get a response, or if they notice that the child is not pointing to something to indicate their need or share their interest, or if the child has some speech delay or they are repeating words, or they have some repetitive behaviors like lining up toys or flapping their hands or going around in circles. These are the things which tell that the child could have. So they can call meet their pediatrician and tell their concerns. The pediatrician would also screen them to understand if their child are at risk for autism, and if necessary, refer for an assessment. Early intervention is very important. It is important because the brain in the first 3 years of life is very receptive to learning skills because it's forming a maximum connections. This does not happen after 3 years. Though there is an improvement, the maximum improvement can happen in the first 3 years of life. So providing these interventions, evidence-based interventions early is important for a better outcome and helping the child in participation. So early identification is done by pediatricians in their routine checkup by doing a screening which involves MCHAT.
What role do parents and school play in supporting the children treatment and they can work together effectively?
So parents are very stressed up when they are informed that either your child is on the spectrum or if the child is at risk. This is natural and it is expected. It's not something nice to be told, but you face the situation for various reasons. Now, once you get that, you might not be happy. The parents might go into a guilt mode or a denial mode and then come back. But it is essential for the for the parents to understand that only if they accept the situation, they will be able to help the child better. Once you accept this, you understand what is good for the child. The interventions, you understand that the interventions that you're being provided, is it right? You travel with your child like any other child, understand what is good for the child, And if you are providing interventions, if they are being given in the right way, if the therapies, when they are given, the goals are set and the progress is being made, and also if the child is getting the periodic checkups to to see if there are any deficiencies and those are corrected, they need to manage their stress. Because if the parents are stressed, they cannot perform the way they can they are supposed to. If they are stressed, they won't be able to look at the children the way they should. So taking care of their health is important. Understanding the course of the disorder and how it progresses will help them to manage. So being educated, trying to get all the information relevant is important. Being sure about the child development center that the child is going is important. Understanding where they can send the child to school, which school is inclusive, understanding that is important. Also, they can train themselves in managing behaviors at home. Having a routine for the child is important, because if you have a routine, the child is able to deal with the challenges better. If there is an alteration in the routine, the children should be explained that this is what it is. So there will be like somebody coming home or will not be going to the school today. If they understand this, they can handle the situation better. So that has to be taken into consideration. As far as the schools are concerned, the schools need to be inclusive. And some of the schools are being inclusive also. It is not easy for them also, because they have children who are regular, in the sense that can follow a regular curriculum, and these children have some problems. So they have to understand that the child could have some challenges, like if there are sounds and children are shouting them and he may not be comfortable, so how they can help with that. Or if the child needs a break in between, understanding that it's okay for the child to go and come back, and explaining to them on a one-to-way or helping with the shadow teacher support. The school will be inclusive when they understand what the challenges the child faces because of him being on the spectrum. So once you know that, you adapt the classroom, make him where he's sitting, or help him with a buddy who can understand what his challenge is, or help him with the attention, or help him with identify what his interests are, and making him do that and giving that as a reward. If the child is more interested in painting, tell him that, okay, we complete the work and then you can do the painting. Things like that will help them.
So, ma'am, parents often worry about the sensory issues in their kids with autism. So, what can be done to help the child who have overwhelmed by sound, light, and textures?
So we need to understand that if we already know that, parents already know that there are certain sounds which he cannot tolerate. So you can use some noise cancellation headphones to help the child, that this is something that he won't be comfortable with. So during that time he can do this. And also keeping him informed earlier that we are going to this place, so there could be some sounds, and we are having the the headphones with you. In case you don't want to, please let us know. We will try to handle this situation. Similarly, the lights, even at home, some people, the decoration, interior decor is such that there are too many bright lights. So you need to see if you can avoid lights which are troublesome to him, and avoid these things which can instigate or lead them to have those behaviors. And this also is, the occupational therapist also works on this by giving them the sensory diet or sensory regulation. They help them with the sensory regulation so that they can handle this gradually. They might not be able to handle completely, but they understand what they can do. if there is something that is disturbing them. So if they have concerns with textures, again the occupational therapist will work on this child by exposing them to different textures in a graded manner. Sometimes they want to feel that sand. Sometimes they don't want to touch it at all. So depending on what they are having, what concern they have, either they expose them to that in a graded manner or help with the avoiding behavior by helping with the sensory regulation and sensory diet.
What the one piece of advice would you give to families navigating an autism diagnosis for their child?
I would tell parents that it is a difficult situation to face, but most of them ask me a question when they come, will my child ever become normal? It's not like your child is abnormal, it's just that the child is different. If you are able to accept that being different is not wrong and it is not abnormal, it is more easier for you to deal with that. Understand that situation has come not because you are responsible for that in any way. You don't need to feel guilty that you are responsible for it or you're not able to do enough for the child. There's nobody who can do more than a parent to a child. So you can, by accepting and helping the child get the necessary therapies at the right time, in a right place, for the recommended time, and helping the child go to a school which is inclusive, and understanding that it does not mean that having an autism diagnosis the child will not be able to do anything. All children with autism have some strengths, and you have to work on those strengths and reduce the weaknesses. So there are achievers. There are people who are on the spectrum who have achieved, who are working as in a profession, working as entrepreneurs, not working as, who are entrepreneurs, who run their own business, who can do things. You have to just understand what their strength is and encourage that aspect while helping him to deal with the sensory challenges or the communication concerns, and they will do an excellent job. So be positive and be informed and be an advocate to that. Thank you. So we at Ankura CDC have a team which specializes in dealing with autism. We provide the occupational therapy, behavior therapy and speech therapy by people who are certified and specialized in this. We also manage the comorbidities which could be associated with this. Thank you.